The elderly, for multiple reasons, are most at risk for hospitalization and death from heat stroke. First, because of their underlying conditions, okay? Oftentimes they already have some amount of heart disease. They may have diabetes. They may have some underlying lung disease. And they may have some amount of cognitive decline, right? That keeps them from being self-aware of the situation, okay? So the setup is there, right, for them to get to a dangerous place.
Hello, I am Celia Sanka, Executive Director of the DiversityCanada Foundation, and this is the Golden Voices, Golden Years Fireside Chat series. The DiversityCanada Foundation is the organization that brings you goldenvoices.com, the website where seniors gather to focus on issues of importance to seniors. The Golden Years Fireside Chat is one where we speak with experts as well as everyday seniors on issues of importance to seniors under the theme of living longer and living well. Today we will be focusing on a very important topic for seniors, a timely topic. During the summer we have extreme high temperatures and sometimes extreme temperatures, and that can be very dangerous to seniors. To help us understand the issue, we have as our guest today Dr. Gabriel Neal. He is a board-certified family medicine physician and fellow of the American Academy of Family Physicians. He is a clinical assistant professor of family medicine at Texas A&M University, which is the oldest public university in the state of Texas, one of the largest, in fact, in the entire United States. And Gabriel is the author of a timely article on heat stroke, which was carried recently in the Conversation, which is a wonderful hub of rich information from the academic world presented for everyday folks like you and me, that we can understand some of these critical issues. You can find his and other articles at theconversation.com. So Gabriel, thank you so much for joining us today.
Thank you so much, Celia. It's a pleasure to be with you.
Thank you. Thank you. So, as I say, it's a timely article because we've had a really tragic situation just some weeks ago, towards the end of June, over in BC and as well down in the Pacific Northwest. I imagine you've been following, or you follow that really tragic situation.
Yes, unfortunately, it seems every summer there are waves of heat that come to various parts of the world. Certainly, it's easy for me to keep track of what's happening in North America, but if you're paying attention to global events, you know that the weather, extreme weather, impacts the United States, it impacts Canada, it impacts Central and South America, it impacts Asia, the Middle East. There's no part of the world that doesn't seem to be being impacted by heat waves. And with it, especially in areas of the world that are not accustomed to extreme temperatures, you have vulnerable populations, particularly the elderly, whose lives are at risk because of that heat, and they don't have a means to stay cool, and people die from heat-related illnesses every year, and they are preventable.
Yes, and it's not a small issue at all. I think the numbers were something like in BC, in that week alone, from June 25th to the 1st of July, there were 808 deaths recorded. And typically, in that span of time, over the previous 5 years, it was something like 198 deaths that you would have.
exceptionally high numbers in situations where normally only a few people might succumb to heat-related illnesses. And so, having lived in the Pacific Northwest for a time, I know that there are many homes that don't necessarily even have air conditioners in them because they haven't needed to have air conditioners historically. But now, when you get several days of 90, 95, 100 degrees Fahrenheit, and even higher, right, which we saw, these, vulnerable populations, namely the elderly, then succumb and either have to be taken to the hospital and may survive, but otherwise will die in those circumstances. And it's unfortunate to see so many hundreds of people die from a preventable type of illness.
So let's take a closer look at heat stroke. What exactly is that?
Right. Well, we historically have called it heat stroke, and I like that term actually because essentially people will pass out. They'll lose consciousness. That's kind of the stroke element, the idea of they've been struck by something and they lose consciousness. Their mental status might change. They become confused. They may wonder about or have confused speech. And it's because of heat. So heat stroke is sort of a perfect lay term for something that doctors will call a non-exertional hyperthermia illness, meaning you're not out running a marathon and creating a high temperature scenario with your body intentionally. You're just doing normal life, walking around, sitting in your home, maybe even just standing in the kitchen or in the park, doing what you normally do. But then you find your body finds itself in a situation where it can't properly regulate that heat. And we're talking about temperatures that get up above 104 degrees or about 40 degrees centigrade, right? And the body can't sweat to like it normally would to lower the temperature. The body might normally increase the respiratory rate as a means to get rid of some heat that way, but it can't. And the parts of our body that normally radiate heat, like our ears and our head and our hands, that is not enough because the external environment is hotter than 104 degrees often in that situation. And so there's no way for that heat to be taken out of the body under normal circumstances, and that's when people begin to succumb then to that illness. So non-exertional hyperthermia is a mouthful, and that's why I think just sticking with heat stroke as a term is something that is actually quite helpful.
I don't think I'm even going to attempt it. Non-exertional hypothermia.
Yeah, hyperthermia. Yeah.
Hypothermia.
Yeah,
Okay,
exactly.
Yes. I think I'll stick with heat stroke.
Yeah, and so what usually will happen is when the symptoms of heat stroke are recognized, right? And a person might, if they have the wherewithal, they might actually ask for help, and someone might then take them to the hospital. But when that's recognized by friends or family in an elderly person, it can be anyone, but I think that focusing on the elderly who are particularly vulnerable is a wise way to talk about this subject. When they recognize that this is occurring, they take them usually to an emergency room, okay? And there, the treatment is fluid resuscitation, meaning they will give the person IV fluids typically, and then applying cold packs to certain parts of the body, like to the neck and to the armpits, to the groin, as a ways to cool the core temperature of the body. So we in the hospital we essentially take over the job of cooling the body because it can't do it on its own. It's lost that ability to self-regulate. And then as those patients usually require some fluids, we give them fluids. And if we can bring their temperature back to normal and fluid resuscitate them, the recovery is usually very good. But it does depend for how long they've been sick, and it depends on how many other illnesses they have in the background of this. And that's again why the elderly are particularly at risk, because our elderly community often has more background conditions than an otherwise healthy 25-year-old might. And that limits their body's ability to recover. And so in heat stroke, we see harm really to almost all the organ systems of the body. We see harm to the brain. We see harm to the heart. We see harm to the kidneys and to the liver and to the muscles. I don't talk about it in the article, but oftentimes heat stroke or non-exertional hyperthermia illness often involves something called rhabdomyolysis, which is where the muscles in the body become inflamed as well, and that can further injure the kidneys. So you can get this cascade of problems that will ultimately result in death if they're not recognized and treated, and you turn the process back to a healing process.
Heat stroke is one of three that I can think about, three heat-related illnesses, and perhaps the most severe. There are others that people may experience before they get to that stage. Tell us a bit more about things like heat fatigue and heat exhaustion.
Yeah, so there's kind of a spectrum, right? You begin the day, let's say, perfectly normal, and you work your way towards the extreme, right? So the extreme end of that is what we were just talking about, which is heat stroke, which is where the core temperature is above 104 degrees in the body. The body's lost its ability to self-regulate and cool off, and there's a true risk of death. Heat exhaustion and fatigue are that area in between when you're on your way. And, I'll tell you, all of us, when we're out exercising, let's say we are a regular runner, we maybe run a 5K daily or a few times a week to stay fit and to stay healthy. And under normal circumstances in the fall, in the winter, in the spring, when the outside temperature is a very pleasant, 70 degrees Fahrenheit, your body has no problem maintaining a temperature of 100, 101 degrees as you're exercising, right? But then summer comes and maybe the humidity rises to above 90%, 80, 90%, and the temperature rises to closer to 90 degrees Fahrenheit. Then you do your normal run, but you find that you're fatiguing more quickly. You're finding that you're kind of out of breath more and you're breathing a lot heavier than you normally would. And then 3/4 of the way through your run, you just find yourself significantly more tired and exhausted, and maybe you're developing some muscle aches that you wouldn't normally experience 2 or 3 kilometers into your run. So this is the beginning of that heat fatigue we're talking about, or heat exhaustion, moving towards that spectrum. Now, for most of us, if we slow down, take some breaths, drink some nice cool water, our body can immediately begin to correct and pull us out of that heat exhaustion stage and bring us back to a more safe level. But in the event that we aren't careful and we're not recognizing the signs of our body's work that it's doing to regulate the temperature, then even otherwise healthy individuals in the wrong conditions, and I talk a little bit about that in the article, which is that when that humidity is above 80, 85%, when the temperature is getting closer to 90 degrees Fahrenheit, that makes it especially difficult even for healthy people to self-regulate, and they move into that heat exhaustion phase. And if they're not careful and they decide, today I'm really going to push through and really challenge my body, even though it's a lot hotter than normal, that's when they get in danger of developing heat stroke. So we have to be wary of those conditions that are not normal for us, and even our normal activity that we might do multiple times a week can be an activity then that puts us in danger. So we have to listen to our body and be aware of the environment.
Why exactly are the elderly more vulnerable to heat stroke and the whole range, heat fatigue, heat exhaustion?
This is such an important question, Celia, and I'm glad you've asked. The elderly, for multiple reasons, are most at risk for hospitalization and death from heat stroke. First, because of their underlying conditions, okay? Oftentimes they already have some amount of heart disease. They may have diabetes. They may have some underlying lung disease. And they may have some amount of cognitive decline, right? That keeps them from being self-aware of the situation, okay? So the setup is there, right, for them to get to a dangerous place because they're coming into the situation often without the same awareness that a younger person might. They might not even be aware of the coming heat wave, right? I mean, most of us are paying attention to the weather, but our elderly aren't necessarily as in tune with the current events as we are. And so they might not be aware that temperatures are going to be up to 105 degrees, right, when they normally would be 85 degrees. And so awareness is a big factor, but then those underlying conditions, okay, such as the heart disease, the lung disease, and the kidney disease, and cognitive decline. But then on top of that, they often are taking medications, and even common medications, namely blood pressure medicine. I mean, most people that I know, my family, my friends, and then of course my patients who are over the age of 65, almost every single one of them is on blood pressure medicine. And most blood pressure medicines, certainly some of the most common ones like hydrochlorothiazide and Lasix, they are a medicine that takes fluid out of our body. And that's a good thing under normal circumstances. That's how it works. But then when you take a medicine that's taking fluid out of the body and then get into a scenario where your body needs that fluid to sweat and it doesn't have it, that's putting you at risk then for heat stroke. Psychiatric medications, right? Antidepressants, anti-seizure medications. There's a long list. Almost any antidepressant, anti-anxiety, anti-seizure medicine will put people at risk for heat stroke. And I can't go into all the technical reasons for why that's the case. We just know that people who take these medicines are more at risk for hospitalization and death with regard to heat stroke. And then there are common anti-inflammatory medications that we might take for arthritis that will put us at risk for heat stroke. So the reality is that most of the elderly community is taking a medicine that increases their chances of heat stroke and death. You could almost have the assumption that someone who is over the age of 65 will probably be on at least one medicine that is increasing their risk for heat stroke. So those I've kind of explained the most common reasons, particularly like the antidepressants and then the high blood pressure medications. But these really contribute significantly to that risk. Yeah. Our body's autonomic nervous system, which is what really helps control like our blood pressure and our temperature, also is a little bit diminished in its ability to respond to situations. And so as we age, our autonomic nervous system's ability to respond is diminished, and that also is a reason why the elderly have a hard time in these extreme scenarios and will succumb.
And that autonomic system is what, without us thinking about it, causes our heart to beat, our glands to sweat.
That's exactly right, Celia. Thanks for that clarification. It does all the things that we don't have to think about doing to live, and it's our autopilot. It helps us digest, and it's what tells us, hey, you're thirsty, go get a drink, right? And I'll bring that up. Patients with Alzheimer's and Parkinson's disease and a number of other things, their thirst and awareness of thirst and dehydration is diminished. And so that's just one more thing that adds to that scenario where someone can die from heat exhaustion, is because it's hot, their body's overheating, and they're not recognizing it, and they're not even necessarily even feeling thirsty, and yet their body is craving water. And staying hydrated is one of the things we'll talk about as a strategy to help prevent heat stroke.
What about obesity? How does that make one more vulnerable to heat stroke?
Well, it's hard to say that obesity in and of itself is necessarily a risk factor for heat stroke. Obesity is a direct risk factor for a lot of terrible things like diabetes and high blood pressure. And I'll throw in cancer, and it's a risk factor for a lot of things. But when you think about obesity contributing to diabetes, and you think about obesity contributing to high blood pressure, and you think about obesity contributing to arthritis, okay? If you have those things, you're on medications for those things, right? And so it builds the case for heat stroke very, very directly. It's hard to get up and move to where you can get help because you have arthritis. It's pressing your body along to heat stroke because you're on those medications for high blood pressure and diabetes, which is increasing then your fatigue, right? Because you're moving from that normal state to heat exhaustion, right? And then you pile on the arthritis and the extra fatigue that's occurring. And then you want to maybe get up and ask for help, right? From your neighbor, or to call your daughter or your son and maybe ask for help. But it's getting too late, because now that heat exhaustion then is moving into the heat stroke range, and you're not thinking clearly, and you don't sense the thirst as quite so well. And then maybe the obesity itself then is just contributing then to just how hard it is to get up and move to a safe space, like a local community center that might have been opened up to that has big AC and can let people cool off, but you can't. So you just stay in your chair in your hot apartment or your overheating home with no AC in it, and that's a setup for disaster. So obesity is, I would say, an indirect risk factor for heat stroke, because it contributes directly to the things that really set people up for heat stroke.
Is there a temperature that we have to look at, or can it happen at even lower temperatures based on what you're wearing or who you are?
Well, I think that you might have a particularly vulnerable person. I imagine like someone who's very old, a 90-year-old frail person who's on a number of medications and has poor mobility. A temperature as high as 85 degrees Fahrenheit, and forgive me for using Fahrenheit, that's just what I'm most familiar with. There are situations where I think a temperature as low as even like 80 or 85 degrees could produce problems for someone who is particularly vulnerable. Okay, but if you look at the data from the National Weather Service and the CDC, we know that when I think of 85 and 85, okay. 85 degrees Fahrenheit and 85% humidity, okay, is something easy to remember. It's not the perfect line, but it's a very easy thing to remember. Some people will remember 90 and 90, okay, but I think a safer line is 85 degrees Fahrenheit, 85 humidity. If it's high, if you're getting that high, then and you are part of a vulnerable population like the elderly, or you're on medication, etc., you have risk factors for this, you need to really be careful about going outside and spending extended time in that hot environment. And so that's what I tell my patients is when it's hotter than 85 degrees Fahrenheit and when the humidity factor is greater than 85%, that makes it very hard for your body to cool off. It makes it very difficult for your body to regulate temperature when you're outside. You need to be inside with an air conditioner, right, with hydration, so that you can stay cool. And but certainly, and we see this a lot in Texas for sure, where I'm from, we see temperatures higher than 90 degrees and humidity factors greater than 90% very frequently in the summer. And that's where we're just basically telling everyone, whether you are in a vulnerable population or not, you need to be careful when you go outside. If you're going to be working out in the lawn and gardening, you better be wearing a hat, you better have some water, and you need to be taking frequent breaks. And if you are the elderly and you're in a vulnerable population, you need to really avoid spending much time outside. And it needs to be very thoughtful for how long you're going to be in that environment before you go back inside and cool off and stay hydrated. So that's my advice from the temperature and humidity standpoint.
What are warning signs, or what are the symptoms we should look for that someone who's experiencing that, or you're seeing that in someone else, we need to act now because there's a real danger here.
So the biggest warning sign, and this comes late. I'll talk about the early signs in just a minute. But if you are checking in on someone, right? You are knocking on the door of your neighbor who you know is elderly, and they at all are not acting their normal energetic self, if they are confused at all, then this is essentially an emergency, okay? And you need to get them to where they can get help. So what I would say is confusion or a mental status change, as we would say in the medical world. If their mental cognitive health or state seems to be diminished at all, that's a giant warning sign that they could be suffering a heat stroke, and that's a late in the process problem that's indicative of a serious situation. Of course, the other thing it can mean is just a stroke, right? Which is another health problem entirely. But that's something that would make me immediately concerned. If I called my mother, who's 70 years old, and on the phone she just wasn't Mom, I'm concerned about you. I know it's really hot where you're at. I'm asking her questions. Are you cool? Are you staying home? Is the air conditioner running? And she wasn't giving me like sharp answers that I know that she can, then that's when I'm going to see her, or I'm calling a family member or a friend to say, I need you to go check on my mom. She doesn't sound right. So, but if you're with someone, right, or you go over to their house and you're checking on them, you're making sure they're okay. At first, we're gonna get real flushed, okay, and that's that autonomic nervous system trying to get blood flow to our face and our hands and our scalp and our neck and our chest, trying to get the heat out of our system and into the air, right? To cool off, okay? So being flushed, our respiratory rate goes up because that's a way to cool off, okay? That would be a way that our body is trying to say, I'm struggling, I'm having a hard time maintaining the right temperature. Then our mouth will get real dry. So pretty soon our body's like, we got to conserve water here so that we can try and sweat it out here, okay? And it could also mean that we're getting dehydrated, so your body's having to take that fluid and put it into the arteries, into the veins to maintain blood pressure. And so then the next thing that happens is that we start to get lightheaded. And so we may not be confused, but we're going to sense that we're really fatigued, and that maybe we need to sit down, and maybe we just are. Some people will say I was feeling dizzy. Okay, that's how we usually explain lightheadedness. So feeling flushed in the face and the hands. Okay, dry mouth. Okay. Starting to breathe more quickly, and then feeling lightheaded. These are some early warning signs that our body is headed towards heat exhaustion or in heat exhaustion and moving towards heat stroke. The other things that people might notice are that they are not needing to go to the bathroom, right? Like they usually might go to the toilet 4 or 5 times a day, or once an hour, once every few hours, but it's been all morning and I haven't needed to go to the bathroom, right? Like that's the body trying to conserve fluid to regulate temperature. So lightheadedness, dizziness, flushing, feeling hot, dry mouth, and then ultimately things like confusion are real warning signs that heat stroke is coming.
Yes, and so pay attention. The individual needs to pay attention to his or her own body, and those around them need to pay attention as well. Now, you mentioned at the start that when it comes to a heat stroke and it's in the extreme, someone can lose consciousness, like they've been struck. And if someone is checking on a neighbor or a loved one, and they find the person unconscious, what immediate steps should that person take to help his or her loved one or neighbor or friend?
Right. So something very simple to do would be in the moment, right? Would be to wet a towel or a rag and wrap it around their neck. Okay, that would be something quick and easy that we usually would have access to right away, and that will begin to help them. That will help their body begin to regulate. The other thing would be to give them water to drink. If they have it, some cold water, right, is important. So if they're able to take a drink, if they're still conscious and you're just concerned that they're getting hot, give them some cold water to drink. Put a cold rag around their neck or on their forehead, have them sit down. These are just the immediate things you can do to get them kind of right away to help. But then the next thing would be to transport them to an emergency room or to a center where they can receive medical attention. And so that's the steps that I would take. You go just checking on your loved ones and particularly the elderly community is the most important step. And if you're doing that, you're going to catch this early before it's probably heat stroke. But those are the easy first steps that can be taken when we find ourselves with someone who's starting to suffer from heat stroke. But ultimately, getting them to a healthcare center where they can monitor that temperature constantly and make sure that it gets back to normal with cold packs and IV fluids. And they actually have cooling blankets now too that are pretty neat technology that can help quickly resolve the situation.
So it would be a sort of a scary situation if someone were to get into that spectrum, the heat fatigue and the exhaustion bordering on the heat stroke. If someone finds a neighbor or loved one in that situation and they get the person calmed down or come back from the brink, it's not a good idea to give them a shot of vodka or something like that to calm their nerves.
No, the alcohol is going certainly will calm our nerves. So I won't debate that. But alcohol is a diuretic, meaning it causes us to pee more fluid out of our body. And whenever we're dehydrated, really, alcohol is one of the last things we should be drinking. Frankly, alcohol is more potent, but also caffeine is a diuretic, and so I wouldn't recommend even caffeinated beverages when we're dehydrated. So if you come across someone who's in heat exhaustion or beginning to suffer heat stroke, the best thing to give them is cold water, not vodka, and not even a caffeinated drink. I would recommend against those types of drinks. Water is the best remedy.
So we've come to a part that would give some practical tips to seniors to prevent us from getting to that stage at all. So what are some of your top tips for keeping safe when we have a heat wave and it's overbearing?
Right. So we've touched on this a little bit, but the first thing I would say is to stay hydrated, okay? And that's because when our body has plenty of fluid, plenty of water, it can use that water to regulate our body temperature, okay? And it also protects our heart and our kidneys and our brain by having that plenty of fluid, okay? Now, this gets tricky when we have someone in the elderly community who has heart failure, okay? And so they might be on a fluid-restricted diet on a day-to-day basis because of heart failure. It's very common. And so in that special situation, it still is important to stay hydrated, and we need to think about it, okay? But they would definitely want to be communicating with their doctor on a almost daily basis. So if I'm a heart failure patient in British Columbia or Seattle in a 110-degree heat wave, right? that's a situation where I'd want to be calling my doctor every day and saying, okay, here's how much I weigh, here's how I'm feeling, and the doctor can then say, great, instead of your 1,500 mLs of water a day, that's your normal restriction, you can have more, you can have 2,000, right? Because of the heat and because we need to give your body some extra without putting that person into overt heart failure and then needing to go to the hospital for heart failure. So I mentioned that special situation because it's becoming less special. There's just usually a lot of people that have heart failure that we have to think about. But heart failure aside, okay, plenty of hydration is key so that your body can sweat and keep the kidneys happy, okay? That's key. And that's, your body can usually take care of the temperature if it has enough fluid to work with.
On the question of staying hydrated, you mentioned no alcohol, no caffeinated drinks, water. What about things like sports drinks and coconut water and those alternatives?
There is a lot of literature on sports drinks, and there are plenty of reasons why we see athletes, who are working out every day and, exerting themselves incredibly, and they will have their sports drink of choice or sponsorship that they're drinking, there at the court side. But there is plenty of research too that shows that water, right, is actually quite good at taking care of us. Okay, and so I think that sometimes taking a sports drink, and this is especially true of children, but also in the elderly, you don't have to drink the sports drink as it comes. You can take it and dilute it with some water too, and it actually becomes in reality, a more effective hydration solution when it's been diluted, like half and half with water. So I certainly wouldn't discourage people from drinking sports drinks. I'm fine with that, but water also works, and you shouldn't feel like you need to get down to a store and buy something special to stay hydrated. You don't. If you have it, that's great. You can even dilute it to stretch it out a little bit, or you can just go with water. So staying hydrated with sports drinks is fine, but it's not required. And coconut water is delicious, so hey, have at it, right? No objection there.
Yeah, and you should drink before you're thirsty. You feel thirsty.
In a scenario where there's a heat wave, I think, and in a vulnerable population, that is a very appropriate approach, which is think about water, think about staying hydrated, and go ahead and set yourself up to just drink regularly in that scenario. Okay, to stay ahead of the game, as we might say. However, there is emerging research in athletes and other things that would say that our body is actually pretty good at telling us when it needs fluids, and so you can wait until you're thirsty to drink. But in these situations where we're having significantly higher temperatures, like in a heat wave and in vulnerable populations, I think the wiser decision is to drink intentionally and not wait until we're thirsty. And the other advantage of that is, what about those community members, right, whose thirst drive is diminished and is not reliable? That advice of stay ahead and drink regularly and don't wait to get thirsty is very critical for that population. So another reason to kind of just say stay ahead, don't wait till you're thirsty in these extreme conditions. Yeah.
Great. So that's a good roundup of that first safety tip that we should be aware of when the temperatures rise. You have others to share with us?
We need to stay cool, right? Like that's really what this is about, is not letting our body temperature get so high and then become unregulated where our body can't bring it back. So your body can only do so much from a sweating standpoint and a breathing standpoint and a vasodilation standpoint. It needs a cool environment ultimately to get that temperature back to where it needs to be. And that's why getting to a cool environment is is really the key treatment. Okay, so how do we do this at home, right? Well, you hopefully would have an air conditioning system and fans, okay? And I talk about fans a little bit. So an air conditioning system actually cools the temperature. It brings the temperature from what it would be 105 degrees or 40 degrees centigrade, right, down to a more comfortable maybe 75 degrees Fahrenheit, right? Something that our body can work with to dispel heat. Fans circulate the air and they help our body's sweating mechanism, okay, to work better, okay? So when we put a fan on us, it's not lowering the temperature, but it is helping our body lower the temperature through that evaporation mechanism that sweating does, okay? And so both are good, but the main thing is just getting to an air-conditioned environment where the temperature is really less than 80 degrees. Okay, that's an environment where our body can do something well. If you live in a home or an apartment that does not have an air conditioning system, then pouring a bath, okay, and getting into a bath with cool water, right? Usually that water that's coming through the plumbing, even when it's 100 degrees outside or 40 degrees centigrade or 45 degrees centigrade, that water that's usually coming up through the ground is going to be closer to 70 degrees centigrade, right? Tap temperature. And so immersing the body in a bath or in a cold running shower, right? Water has the ability to absorb a lot of energy, a lot of heat, and so putting our body into a body of water quickly can cool the body and then prevent our body from getting too high. So many lives have been saved, frankly, by the elderly being able, or the vulnerable with no air conditioning, being able to draw a bath and frankly sit in the bath through the hottest hours of the day and that keeps them cool. And of course then that evaporation is occurring too with the water on our skin and whatnot. So being in water, being in a bath at home is a powerful protective mechanism. And so whether it's through an air conditioning system or drawing up cool bath and being in that, those are great ways. The other then is calling your local health department or your city governance and finding if there's any community temperature relief centers, right? It might be a library, it might be a shopping mall, right? Shopping malls usually have air conditioning indoors, and so going to one of those places where you can sit and cool off is a powerful way to protect yourself from a heat wave when your home doesn't have the ability to give you an environment that's safe.
I love the idea of lounging in a bath all day long.
Yes,
No
but you have to be careful not to have the glass of wine though when you're lounging in the bath, with
Yes,
the candles during the heat wave. Maybe not have the wine. Just some nice water, some coconut water with your bath is better. Yeah.
Yes, yes. One final area in terms of the activity and when we engage in any activity indoors, outdoors during really extreme temperatures. What's your advice?
So we extreme caution. I want my family and my patients to stay active, right? It's good for us. It's not good to just sit around at home all day and do nothing. That's bad. But we really do have to use caution when we are going to be outside doing activities in extreme temperatures. And frankly, extreme temperatures are anything above that 85 and 85, 90, 90 line. I mean, it certainly gets worse. Like when we're talking about 40 degrees centigrade or 45 degrees centigrade, this is really, really, really extreme. So you have to say, I usually would be out for 45 minutes or an hour, right, in a stroll through the park or a jog. But because of the temperature, this is going to be a 5 or 10 minute loop that I'm going to do. And then I'm going to see how I feel. And I'm going to intentionally hydrate with some cold water. And then I might even rest then for an hour. And then if I'm feeling good, I might go for another 5 or 10 minutes, right? So you take precautions to give yourself the ability to recover from a temperature standpoint and a hydration standpoint. So even the fittest person, right, shouldn't be out there in these extreme temperatures doing their regular things when that's not the environment that they're normally doing it. Right now we have the Olympics, and already there are reports of athletes, right, and these are very fit athletes, right, who have seen their abilities compromised, right, by temperatures that are above 90 degrees, and so I think that's just a good reminder that even the fittest, the most active and fittest outdoor athletes will struggle when the temperatures are greater than 85 or 90 degrees Fahrenheit. And so if they have to take extra care in those environments, us regular non-Olympic athlete people certainly have to be careful as well.
In terms of how we dress when we're going outside, what are some of the extra precautions we should take when there's danger from the temperatures?
Yeah, thanks for bringing that up. Our clothing can make a big difference. We advise a loose-fitting, breathable, light, and even light-colored can be helpful clothing to reflect away heat and then allow our body's normal mechanism of cooling, that sweating process, to do that work. And so if you're wearing constrictive clothing that is not breathable and that is like black or dark colored, that's going to absorb. It's going to be hotter than a light colored clothing would be. You're inhibiting your body's ability to self-regulate temperature. So loose fitting, breathable clothing that is light colored is the safest clothing to wear when you're exercising or being active outside and the temperatures are high.
Those were the areas that I had to cover. Is there anything that we haven't touched on that you would like to round off our discussion with?
I would just circle back to that the people who die during heat waves are people who because of illness and age cannot look out for themselves, and who often normally can, but then when a heat wave comes, cannot. And so we certainly need to look out for ourselves and be careful, but we must check on our neighbors. We have to think about the people in our communities that we know, particularly those who live alone, right? So those who live alone, who have other illnesses, who are elderly, we need to check on them when the temperatures are unusually high. This is how we are good neighbors. This is how we are good citizens, is by checking on these vulnerable populations. And so I think most of us can usually manage and protect ourselves, and we can be thankful for that. So the next step then is to look out for those who really can't look out for themselves. That's what I would leave us with, is please reach out to your neighbors in your community who might not be able to look out for themselves when heat waves come.
Thank you very much for that. That is a beautiful note to end on. Not only during a heat wave, but I think all throughout the year. Being a good neighbor, that's what makes the world a sweet place to live in. Good communities. Thank you so much for everything that you've shared with us, Dr. Neal, Gabriel Neal. He is a board-certified family medicine physician and clinical assistant professor of family medicine at the Texas A&M University. It's been a pleasure speaking with you.
Thank you so much, Celia. Pleasure's all mine.
I'm Celia Sanka, Executive Director of the DiversityCanada Foundation, and today we have been speaking about heat stroke and how we can prevent problems in the situation where we have high temperatures that can be really a problem for the elderly, for seniors. We've been speaking with Dr. Gabriel Neal, who is a board-certified family medicine physician and fellow of the American Academy of Family Physicians. He's also a clinical assistant professor of family medicine at Texas A&M University. Thank you so much for being with us at goldenvoices.com for the Fireside Chat today, and please do join us at goldenvoices.com for others in the series of the Golden Years Fireside Chat. Until we meet again next time, take good care of yourself. Bye for now.